Nigeria. 220 million people. One of the most vibrant nations in the world. But beneath the surface, in rivers, in the soil, in food, in the air, things are waiting. Things that burrow into your body, that invade organs, that destroy eyes. Some kill within weeks, others live undetected for years, and you never know. These are the top 10 most dangerous parasites in Nigeria. From annoying to deadly, from unsettling to almost unbelievable. Stay with me, because number 1 frightens even doctors. Number 10, the pinworm. Let's start with the one that's most common, and yet almost nobody talks about it. The pinworm is small, a few millimeters, almost invisible. It lives in the intestine. At night it crawls out to lay eggs, exactly where it's most uncomfortable. The result? Intense itching, sleeplessness, irritability. Children scratch themselves, touch surfaces, infect others. A single infected person can infect an entire classroom. In Nigeria, this affects mostly children in overcrowded conditions. The true number of cases is enormous, because almost nobody talks about it. Dangerous? Not directly, but a parasite that crawls out of the body at night. That counts. Number 9, the roundworm. Now things get a little bigger, much bigger. The roundworm can grow up to 35 centimeters long. It lives in the small intestine, and it doesn't work alone. Some people carry hundreds of them inside, without knowing it. In Nigeria, it is one of the most common parasites of all, transmitted through contaminated water, soil, food, when only a few worms are present. No symptoms. When many, abdominal pain, malnutrition, developmental delays in children, and in rare extreme cases, when they tangle together, they block the intestine or migrate into the lungs. Then the person coughs up worms. Yes, you read that correctly. Number 8, the hookworm. This parasite doesn't wait to be eaten. It actively breaks through the skin. Larvae live in the moist soil of Nigeria. Walking barefoot? The hookworm is there. It bores through the sole of the foot, travels through the bloodstream, and ends up in the intestine. There it hooks itself in, sucks blood, day after day. The result? Anemia, exhaustion. In children, developmental delays. In pregnant women, dangerous complications. It is widespread in rural regions of Nigeria. Not because people are careless, but because shoes are a luxury not everyone can afford. Number 7, leishmaniasis. Until now, all the parasites have been worms. That changes now. Leishmania are microscopic single-celled organisms, transmitted by the bite of a sandfly, barely larger than a speck of dust. What they cause is anything but small. Cutaneous leishmaniasis, wounds on the skin, ulcers that spread, scars that remain. Visceral leishmaniasis, also known as Kala azar. The parasite attacks the liver and spleen. Left untreated, this form is fatal in nearly 100% of cases. Nigeria is a high-risk area, especially in the north of the country. And the insidious part, symptoms often don't appear until months after the bite. By the time a diagnosis is made, the parasite has already colonized entire organs. Number 6, bilharzia. Imagine you're swimming in a river, clean, clear, inviting. And in that moment, invisible larvae are boring through your skin. That's how schistosoma works. These flukes live in water. Their larvae swim freely. When skin makes contact, they enter, without pain, without warning. Inside the body, they migrate to blood vessels around the bladder and intestine. There they lay eggs, thousands per day. Some eggs make it out, others get stuck in the tissue. The immune system reacts, attacks, causes chronic inflammation. Long-term, liver damage, bladder cancer, internal bleeding. Nigeria is one of the most severely affected countries in the world, and many people don't even know they're infected until the damage is done. Number 5. The guinea worm. This parasite has been described since ancient times. The Bible may mention it. Hippocrates knew it. And its life cycle is, there is no other word for it, horrifying. The person ingests the larvae through contaminated drinking water. Inside the body, the worm grows, silent, invisible, for an entire year. Then it begins to migrate through the subcutaneous tissue toward the skin. It causes a blister, usually on the foot or leg. When the blister bursts, the head of the worm emerges. What follows is the only treatment, slowly winding the worm over days or weeks around a stick, centimeter by centimeter. If it tears, a life-threatening infection threatens. The World Health Organization has been working toward eradication for decades. The guinea worm is almost defeated. Almost. Nigeria is one of the last countries where it still occurs. Number 4. Malaria. Yes, malaria is a parasite. Not a virus, not a bacterium. A single-celled parasite transmitted by mosquitoes. And Plasmodium falciparum is the deadliest kind. Nigeria carries the highest malaria burden in the world. Around 25% of all malaria deaths worldwide occur in Nigeria. That is over 80,000 people every year. Most of them children under 5 years old. The parasite invades red blood cells, destroys them, multiplies. Without treatment, high fever, convulsions, organ failure, death. What makes it so dangerous? It develops resistance against medication. Again and again, it adapts. The parasite and the human, an endless arms race. And to this day, humans have not won. Number 3. The eye worm. Now we enter territory that feels like science fiction. It isn't. Lower lower is a filarial worm. Transmitted by the bite of a deer fly, the larvae migrate into the subcutaneous fatty tissue, and they grow up to 7 centimeters. Then they start to migrate through the body. You feel it, a crawling sensation beneath the skin. But the moment that those affected never forget, when the worm migrates across the eyeball, you can see it, directly beneath the conjunctiva, a moving line. It hurts, it lasts minutes, and there is nothing to do but wait. Lower lower is widespread in the rainforest regions of Nigeria. Treatment is possible, but complicated. Because if the worm dies wrong, too quickly, the breakdown products can trigger brain inflammation. Even the treatment is dangerous. Number 2. Neurocysticercosis. Almost everyone has heard of tapeworms, but this is different. The pork tapeworm, transmissible through undercooked meat or contaminated water. In the intestine, unpleasant, treatable. But sometimes something else happens. The eggs enter the bloodstream, and from there, into the brain. There the larvae form cysts, small cavities filled with liver's parasite. The immune system barely notices them. The larvae camouflage themselves. Months, years can pass. Then the larva dies, and the immune system reacts. Epileptic seizures, without warning, without known cause. In Nigeria and large parts of Africa, the pork tapeworm is one of the most common causes of epilepsy. Many patients are never properly diagnosed. They live with seizures, not knowing that a parasite is sitting inside their head. Think about that. Number 1. River blindness. And now we come to the parasite that even experienced tropical medicine specialists respect. Onchocerca volvulus, better known as the cause of river blindness, transmitted by the black fly, which breeds near rivers. In Nigeria, millions of people live along such waterways. In rural areas that depend on the water, the worm penetrates through the skin, grows, forms nodules beneath the skin. The female can live for up to 15 years, and every day it releases thousands of tiny larvae. These larvae penetrate the entire tissue, the skin, the lymph nodes, and the eyes. In the eyes, they cause chronic inflammation. The cornea clouds over, slowly, relentlessly, until the person is blind. Onchocerciasis is the second largest infectious cause of blindness in the world. Nigeria is one of the most severely affected countries. What makes it especially cruel? It strikes mostly people who spend their lives near water: fishermen, farmers, families, people who have no choice. The WHO is fighting back with medication programs. But Onchocerca volvulus is not defeated. It is still waiting, in the rivers, in the flies, in the skin of its hosts, invisible, patient, for thousands of years. Parasites don't always kill quickly. Some need years, decades. They are patient in a way that is completely alien to us. Nigeria fights, science fights, and for millions of people, this is not an abstract topic. It is everyday life. But here is the question that won't leave my mind. How many of these parasites are already living inside people, without them ever knowing? Write it in the comments. And if you think that was already the most extreme thing nature has to offer, just wait for our next video.